So the great thing is urology as a field, I think, is a couple of things. Is the ability to work with patients both acutely and doing surgeries and the ability to diagnose and fix a problem immediately. But we also have a lot of patients that we follow long-term throughout the course of their life from the time that we maybe diagnose them with a problem. Prostate cancer is a great example of that. We have this longitudinal care of the patient throughout their workup, their diagnosis, and their treatment going forward. And that's really been rewarding to work with people in that way. When it comes to choosing the right treatment for the right patient with prostate cancer, it can be a very difficult decision for patients. There are a lot of potential options. Focal therapy offers, I think, a really great competitive advantage for both me as a doctor as well as for the patient. The main benefit to that is compared with radical surgery or radiation therapy, patients have a much lower chance of having issues like sexual dysfunction, erectile dysfunction, or incontinence. And with surgery, patients often for a period of time are dealing with leakage of urine, and they may deal with erectile dysfunction, and the healing from that may happen to varying degrees, but it's a little hard to really assure the patient that they're not going to have those kinds of functional issues that they may need to deal with. And for some men, those can be permanent. So I have a lot of patients when they come back to discuss prostate cancer, we often sit down with both the patient and their spouse or partner. And so functional outcomes are really first and foremost for many couples going into prostate cancer therapy, because it potentially affects not only the patient, but their partner as well. So the ability to talk with them about a treatment option that really limits the risk to sexual function, I think gives a lot of reassurance to both the patient and the partner that we're going to go through this together and hopefully be able to treat them with very minimal impact to their lifestyle and be able to recover very quickly and get back to normal functioning as though nothing ever happened. Focal therapy, by avoiding injuring those structures around the prostate, we really limit the risk to the patient. And so studies have definitely shown that the likelihood of erectile dysfunction is much lower with a focal therapy treatment than with radical prostatectomy or radiation. What really excites me about focal therapy, I think, is the potential for innovation. I love when I have the ability to offer patients options that I think might be right for them. My goal for treatment of prostate cancer for all of my patients, as much as possible, is first and foremost, of course, to treat the cancer and to hopefully cure the cancer and achieve a long-term remission, but with the least amount of potential side effects, ideally no side effects at all. And I think that the Focal One HIFU focal therapy option gives us the best possible chance of that for the appropriately selected patient.